Tic disorders are neurological disorders that cause involuntary movements, vocalizations, called motor and vocal tics respectively. Tics can be both simple and complex. Simple tics consist of a small muscle group and complex tics consist of a large muscle group. Patients may experience uncomfortable physical sensations prior to ticking, known as premonitory sensations, and/or premonitory urges prior to a tic occurring. Complex motor tics include involuntarily imitating someone else's movements, involuntarily imitating one's own movements, involuntarily gesturing obscenities, involuntarily imitating a drawing or writing made by someone else, involuntarily repeating a drawing or writing made by oneself, and involuntarily drawing or writing obscenities. Complex vocal tics, on the other hand, include involuntarily imitating a sound made by someone else, involuntarily imitating a sound made by oneself, and involuntarily uttering obscenities. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, is a classification of mental disorders designed to facilitate a reliable diagnosis of mental disorders. 5 tic disorders known as provisional tic disorder, persistent chronic motor vocal tic disorder, Tourette syndrome, other specified tic disorder, and unspecified tic disorder. A diagnosis of a tic disorder is based on the presence of either both motor tics and/or vocal tics, the duration of the tics since the onset of the first tic, the age of the onset of the tic disorder, the absence of any known cause of the symptoms, and that the diagnostic criteria have never been met for another tic disorder. Patients with PTD have either only motor or only vocal tics, or both motor and vocal tics, whereas patients with PCMOVTD have either only motor or vocal tics. Patients with Tourette syndrome have both motor and vocal tics. In the cases of other specified or unspecified tic disorders, the tics or tic-like symptoms are characterized as tics that are atypical, either in presentation and/or age at onset, or have a known cause. In cases where patients are diagnosed with OSCD, clinicians choose to specify the reason the presentation does not meet the full diagnostic criteria for a specified tic disorder. In cases patients are diagnosed with UTD, on the other hand, clinicians choose to not communicate the specific reason that the presentation does not meet the full diagnostic criteria for a specified tic disorder. PTD was previously called transient tic disorder in the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision. TTD is characterized by single or multiple motor and/or vocal tics that occur many times a day, nearly every day, for at least 4 weeks, but for no longer than 12 consecutive months. The onset of a transient tic disorder is required to have occurred before the age of 18. The disturbance caused by the symptoms must not be due to the direct physiological effects of a substance or another medical condition. The diagnostic criteria of a transient tic disorder must have never been met for Tourette syndrome or persistent chronic motor vocal tic disorder. The cause of a transient tic disorder is indicated by clinicians by specifying a single episode or recurrent episode. PCMOVTD was previously called chronic motor vocal tic disorder in the DSM-4-TR. Chronic motor vocal tic disorder is characterized by the presence of either single or multiple motor vocal tics, which occur either many times a day, nearly every day, or intermittently throughout a period of more than 1 year, where a tic-free period that lasts for 3 consecutive months have never occurred. The onset is required to have occurred before the age of 18. The disturbance must not due to the direct physiological effects of a substance or another medical condition. The diagnostic criteria must have never been met for Tourette syndrome. Tourette syndrome was previously called Tourette's disorder in the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision. Tourette's disorder is characterized by the presence of both multiple motor and/or one or more vocal tics that occur many times a day, nearly every day, or intermittently throughout a period of more than 1 year, in which a tic-free period must have never occurred over the span of more than 3 consecutive months. The onset is before age 18 years. The disturbance is not due to the direct physiological effects of a substance or a general medical condition.